How to avoid getting pregnant when you do not want to have children. Various contraceptives protect against unplanned pregnancy. Talk to your doctor or midwife about what you want, and they can find a contraceptive that is right for you. It is normal to experience light bleeding when you start a new contraceptive. Women respond differently to contraception. Even if your friend uses something she thinks works well for her, that does not necessarily mean it will be the best option for you. If you experience pain or discomfort, it is important that you contact your GP or fastlege. It is a good idea to talk to your partner or a friend about this, but remember that what is good for a friend may not necessarily work well for you. You make your own decisions about your own body. Breastfeeding is not the same as contraception and does not guarantee that you will not get pregnant again. All contraceptives protect against unplanned pregnancy. Condoms also protect against sexually transmitted infection. There are more hormones in birth control pills than in IUDs because the IUD acts locally in the uterus, while the other birth control methods affect hormones in the blood. A larger amount of hormones leads to better contraception, but you may experience more side effects. The safest method of contraception is a contraceptive implant or an IUD. A contraceptive implant, otherwise known as Pastov, prevents ovulation, makes the lining of the uterus thin. In addition, a mucus plug forms at the cervical opening to prevent sperm from entering. This is inserted into the arm just under the skin. You will receive local anesthesia first. This provides protection for 3 years. There are 2 types of IUDs, one without hormones, which is called a copper IUD, and one with hormones. The copper IUD affects the sperm cells so that they are unable to fertilize an egg. Some women experience more severe menstrual cramps and more bleeding. Often, those who have previously had heavy periods experience more side effects. The copper IUD is best for those who usually have light bleeding and mild menstrual cramping. A hormonal IUD works by preventing the buildup of a mucous membrane or lining inside of the uterus, which typically otherwise happens with ovulation. Instead, the mucous membrane or lining inside the uterus remains thin. As a result, a fertilized egg will not be able to attach. In addition, a mucus plug forms inside the opening of the cervix, so that the sperm cells are not able to enter. Most women who have hormonal IUDs have little or no bleeding. It is normal to experience some light bleeding in the beginning. This is completely normal and not dangerous. Many women who have had heavy and painful periods and heavy bleeding for years are very happy with the hormonal IUD because this helps lessen the pain and bleeding. The hormonal IUD can remain in place for 5 years. If a woman would like to get pregnant again, she can go to her midwife or fastlege to have it removed. You need an additional examination if you want to have an IUD inserted or if you want a pap smear. If you are over 25, you should have a pap smear every 3 years. This is important. Let your midwife or doctor know if you had not had a pap smear before. A pelvic exam may be necessary if you have itching, burning, abnormal or foul-smelling vaginal discharge or skin changes. If you have pain in your ovaries, you must see a doctor. If you would like an IUD, the pelvic exam and insertion of the IUD are performed at the same time. Who can I talk to about women's health? You can also go to your fastlege when you are not pregnant and have questions about your body or health. If you have a positive pregnancy test, contact a doctor or midwife. Midwives specialize in care during pregnancy and childbirth. Gynecologists are doctors who specialize in women's health. You will be referred to a gynecologist if necessary. You can also go to a private gynecologist, but then you will have to pay for this yourself.